The Sexual Health Service on the island provides free, confidential, non-judgmental service to the island folk. We provide contraceptive and sexual health advice. We supply contraceptives to those that require them, and also we do screening for sexually transmitted infections, including bloodborne viruses, HIV and hepatitis C. We also offer a pregnancy advisory service for those ladies who are considering termination of pregnancy. We work very closely with our public health and our health promotion colleagues to make sure that the service is consistent across the island. We'd like to think we supply a high quality department so we can give the island folk a good service. The reason that we brought all those services together and integrated them was that we were seeing that some clients were coming in for contraceptive purposes but also needed sexual health advice and screening. We're more than happy to see people who feel that they may have an infection and offer them treatment which is free and ongoing care and management. But also we're happy to see anybody who just wants a check-up for a peace of mind. And again, we can actually offer them treatment if they subsequently need it, and we can look at their contraceptive needs at the same time. The pregnancy advisory service aspect of the department is referral by other healthcare professionals. So we will see those ladies who are thinking about the choices that they'd like to make. We will scan them to establish how many weeks pregnant they are, and then we can discuss with them the options that are available to them. If they choose to have a termination, then we are able to facilitate that within the department. But we give a lot of time to those particular clients in order for them to make the choice that is appropriate to them. The service is predominantly nurse-led. We do have a number of doctors who work with us at various times during the week, but it's predominantly, as I say, it's a nurse-led service. All the nurses are skilled in the area of sexual health, all have got contraceptive training as well. So we aim to provide a really good service for those folk of the island.
When you're in the clinic, the first thing we will ask you to do is give us some personal information. We'll make up a set of notes and we'll keep your information strictly confidential to this department. We just need your name, your date of birth and perhaps your mobile phone number if you have one. Then we'll call you through into a confidential room. No one else can hear the conversation. It'll be between you and the nurse or the doctor that you're talking to. The information we write down is kept within the clinic and no other members of staff in the other parts of the hospital are able to look at those notes. Most of our staff are very experienced in all matters around sexual health, so please don't be feeling embarrassed or worried that you're going to tell us anything that might shock us. We'll ask you about some medical information, perhaps if you're on any medication. We'll ask you about your medical history, and then we'll ask you some more detailed and personal information. If you're a woman, we'll want to know when your last period was, and we'll also want to know when was the last time you had any sexual contact with another person. Do remember, everything you tell us is strictly confidential and no one else will know this information. If you need an examination, you'll be shown into the examination room. There you'll be asked to undress from the waist downwards and to lie on a couch. For men, you'll probably be asked to stand up and drop your trousers and underpants down. If you prefer to have a friend with you, perhaps your boyfriend or girlfriend or someone who's come with you to the clinic, that's fine. Or there will be a nurse who can chaperone you. If on the other hand you prefer to be on your own, we're just with the person that's going to do the examination, that's fine as well. Just let us know what you feel most comfortable with.
These are the sort of swabs that we would use. For a woman, we use these swabs for taking samples from the walls of the vagina, which we then put onto a slide or then inoculate onto a plate. For men, there are no umbrellas. This is the only swab that would go into the entrance of the penis and only about 1 centimetre inside. We'd then use that to put it onto the slide and again to inoculate a plate. Occasionally we would have to use a cotton wool swab and a tongue depressor to take some swabs from the back of somebody's throat, and sometimes a specialist swab that again is no different than a Q-tip to swab a sore perhaps on the genital area.
After you've had your swabs taken, they're taken to our laboratory, our hot lab here in the department. we're able to process those quite quickly and give you some results in about 10 to 15 minutes. So if you have got symptoms, or if you're worried that you have got an infection, sometimes we can give you a result immediately. We can also provide you with treatment quickly. We're able to give you medicine without charging you, so it's free as well as being confidential. No one will know you've had treatment unless you want to tell them. All the medicines are stocked within our department, so we don't give you a prescription and send you to another part of the hospital or to a chemist. We have all the drugs available here. Once you've been prescribed some medication, the nurse or doctor will explain to you how to take the medicines and then advise you whether you need to come back to the clinic for a follow-up appointment or whether we can talk to you over the phone, perhaps in a week or two. When we do that, we'll give you your test results and we'll discuss with you how you got on with your medication, whether you had any problems or side effects. Once you've had an internal examination, you'll be offered an HIV test. This is a routine thing that we offer everyone who attends the clinic now. And if you want to have that done, one of the nurses in our department will take your blood sample. It's just a small amount of blood, about half a teaspoonful, and the results are available within a week. If you've got particular risks for HIV, or if you're especially worried, we can do an instant HIV test. This is a prick from the fingertip and it's a small amount of blood, just a few drops, and we're able to give you an HIV test result in about 2 to 3 minutes. We're able to offer you pregnancy tests, so if you're worried that you may be pregnant, come and see us. A pregnancy test involves you passing urine into a little pot, and then we do the test. It takes about 3 minutes to give you the result. If your test is negative, we'll be able to advise you whether you need to be starting to use regular contraception or if you need to have a repeat test at another time. If your pregnancy test is positive and you don't know what to do, we can talk to you about what your options are. If you want to be referred to a midwife for antenatal care, we can arrange that. Or if you need more time to think things through and discuss it in more detail, we can offer you that support as well. If you're not pregnant and you need contraception, all methods of birth control are available here in the clinic. That includes contraceptive pills, implants, coils, and advice about all methods if you're not really sure which one to choose. If you've had unprotected sex and it's still within 72 hours of unprotected sex, we can give you emergency contraception. Sometimes called the morning after pill, these tablets are very effective if taken quickly following sex without contraception. If you're a little bit later than that, we can offer you an emergency coil. And this is just like an ordinary contraceptive coil, and it's put into the vagina, into the uterus, and it's left there until your next period starts. If you like that as a method of contraception, of course it can stay in for as long as you'd like. We routinely offer everyone who attends the clinic a blood test for syphilis and for HIV testing. But for those patients who've been at risk, we also offer screening for hepatitis B and hepatitis C. If you're negative for hepatitis B, there is a vaccine that's available. This is a course of 3 injections into the upper part of your arm, given 1 month apart. And this will provide you with ongoing protection for several years against being infected by hepatitis B virus. For those people who test positive to hepatitis B or who test positive to hepatitis C virus, we refer you to the expert team in Southampton.
Hello, my name's Richard Harvey. I'm here on behalf of the Sexual Health Services to encourage people to let them get tested as soon as they possibly can. Because I'm quite fortunate. So my HIV is a little negligible. But there are people walking around out there who have probably got a blood-borne virus and are completely unaware of it and are obviously spreading it due to their ignorance. And people really should get tested. And the stigma, you should just ignore the stigma. I've found the services useful as in they've actually got the information. There's no good relying on hearsay and what some bloke says down the pub or what somebody picks up off the internet. Go to the professionals. Anything else is just superfluous and a waste of your time and anybody else's time.